Ready to start. Hi, Kim.
Hi.
Hi there. Hi there. Well, I want to welcome everyone. I'm sorry, I'm looking at my screen over here. I want to welcome everyone to hashtag Friday Night Chats with Dr. Karen Love. It's been so exciting to just exploring topics on leadership each week from various industries. And I just wanted to take a break this time and just deviate from the topic of leadership in terms of your professional career and just talk about some of the personal issues we might have because of COVID-19. Right now, we have parents at home with young children who need special resources, and perhaps they're not receiving the necessary resources for their children to perform successfully in school. Another factor could be their dietary needs or lack of dietary deficiencies that has been exposed, and having a conversation about that, I thought that that was important as well. So we're going to get into that tonight. We are welcoming Dr. Denise Purvis, Takesha Brooks, and Gretchen Eldridge from Judson University. I'm very, very proud of Dr. Purvis and her candidates, her students. I won't say candidates yet, students, because of the fact that they are in clinical counseling, very knowledgeable of the subject, and they have a lot to share tonight. So welcome, everyone.
Thank you.
Okay, I'm going to share the screen now. Dr. Purvis, would you like to introduce or say more about your students before we get started?
Sure. I think that Dr. Karen Love has done a tremendous job in providing some options for the community. She is such a natural leader, and she provides myself and my students a lot of opportunities to step up to the community, because in our counseling role, for Gretchen and Takesha, is they both are advancing quickly towards graduation, that they have a lot of opportunity to serve and to advocate for others. And by providing presentations and information, this is really a gift and an honor as a counseling faculty, and also for the students, because it's our role to give back, share knowledge, provide resources, and this is a great opportunity to do that. And so we're just really grateful to be here. Takesha and Gretchen are just a gift to the Judson community as students. And so it's such a privilege to mentor them and also to be mentored by Dr. Karen Love. So thank you so much. And Takesha and Gretchen will go ahead and start the presentation.
Okay, let's share the screen.
Okay.
Here we are.
Okay. So I'm going to start, and I just want to reiterate what Dr. Purvis said and Dr. Love. We are I know I am very excited. Keisha and I have spent a lot of time talking about this subject. I'm excited to be a part of such a great thing. So I appreciate the opportunity. I mean that from the bottom of my heart. I really do. So thank you for having us tonight, and hopefully you will walk away from this more knowledgeable, and we will walk away from this more knowledgeable as well. So we're going to go and dive right on in to our presentation tonight. And the title of that you can see on the screen is Sugar, Neurotoxicants, and Attention Deficit Disorder.
Is there a way to put it in presentation mode? Slideshow.
There you go. Maybe a little bigger on the screen. Even better. Thank you, Keisha, for even noticing that. So, okay. So the objectives of tonight, the things that we want to really try to cover, is to give you a sound definition of ADHD, just to give it to you from a clinical aspect and for you to understand it as well. So that includes increasing your knowledge of ADHD, and also some of those symptoms to look for and triggers that could be contributing to ADHD behavior. And then we will follow up with some prevention, some information on prevention, and some tips for your coping and coping mechanisms for you and your child. So you can go to the next slide, Dr. Love, please. I think you go back just one to the, go back just one.
Well, yeah.
Yeah, the core features.
Yeah.
There we go. So inattention and hyperactivity, impulsivity are core features of ADHD. And I would like to kind of touch on each one of those. When you look at inattention, it may look like a child who wanders off task, is easily distracted. I think we've all probably heard that phrase. You're having a conversation and you're like, oh, look, a squirrel, right? So a lot of people will say, I'm sorry, I'm ADHD, there goes a squirrel. But in the mind and in the behaviors of someone or a child that is suffering from ADHD, they really, really can wander off task. Like they have those, oh, there's a squirrel moments quite frequently. A lack of persistence with the inattention. So if you're a parent of a child who has ADHD, you may try to get them every morning to make their bed or pick their clothes up in the bathroom after they shower. And you may have like 2 really good days of that. They're making their bed, they're catching on, but then day 3 happens. And all of a sudden the clothes are back on the floor and the bed is unmade. And there's no consistency with that. And that can be super frustrating as a parent, but it can be even more frustrating with a child suffering with ADHD. It's hard for them to focus and to be persistent with those behaviors. So that kind of explains that. And it's also very easy for them to be very disorganized, have a lot of different things going on at one time, very forgetful. You go to the ball field, every time the game is over, they forget their cleats, they forget their bag, they forget their bat, they forget their ball. So you're always going back and getting those items, it can be very disorganized and it can feel a little bit overwhelming. So when you go into the hyperactivity, that involves more of motor activity, right? So they can have a lot of bodily movements, a lot of fidgety, tapping your foot, moving around, squirming around in their seat, unable to sit still, unable to be still. So that can be very hyperactive. And a lot of times people will say, I get that restless feeling. I feel like I need to be doing something. And I think as human beings, we all get that at some form of a time or another, especially when we have a lot going on through the week or through the workday. For a child with ADHD, that restless feeling is pretty prominent most of the time. So that's something that you need to consider, we need to consider, teachers should consider for an ADHD child in a classroom or in a home. The impulsivity part of it can be observed as taking spur of the moment actions without thinking them through. There's a meme, I'm not sure if you guys have seen this or not, but it shows a person's face who looks very shocked or surprised. And on the meme, it says, "Did I just say that out loud?" So I think we have all had that moment of, did I really just say what I was thinking out loud? Oh my gosh, without thinking through what I'm going to say, I just blurted it out, right? So with a child with ADHD, that can happen quite often. They can be very focused on wanting to say something. It can come across very rude sometimes, but that doesn't mean that they're being rude. Their brain has focused on something that they want to get out. And they've got to stop you talking so they can make their point and get it across. So that's what that can look like. We'll go to the next slide. And this is patterns of presentation. So according to the DSM-5, there are 2 patterns of behaviors that indicate ADHD. One, if you see on the left, is inattentive presentation. And then the second one is hyperactive impulsive. So you could have a child that presents with the inattentive presentation, or you can have one that presents with hyperactive impulsive. But you can also have a combined type. That means that you actually, the child or even the adult, you know, we're focusing on children, but this can also affect adults as well, could have a combination of both. And that just clearly, that's what the combined type means in the DSM-5. So we
Yeah,
will,
like, sorry. Clinically, like if a child like gets a diagnosis, like these two are called like specifiers. So you have ADHD, inattentive type, ADHD, hyperactivity. You know, those are more of the specifiers, or it can be a combined type. So when if your doctor is giving you a diagnosis, then that might be on there.
yes, thank you, Keisha, for explaining that. Yes.
Sorry.
No, you're fine.
From a non-clinical person, what does DSM-5 mean?
Yes, so the DSM-5, thank you, Dr. Love, that's a great question. The DSM-5 is a diagnostic material that we use as clinicians to come up with a diagnosis. And we're going to dive into the DSM a little bit in actually the next couple of slides. So we go through the symptoms, right? And we come up with their behaviors, as parents would give us the symptoms or the behaviors that they're displaying. And there's a certain amount of a criteria that they must meet in order to receive a diagnosis. So the DSM-5 helps us be certain that we're coming up with the right diagnosis and not just pulling it out of the sky. And do you, Dr. Purvis or Keisha, do you have a better way of explaining that or want to add to that?
Oh, that's perfect.
Okay, thank you. Okay, so we'll go to the next slide and we'll get a little bit more into the symptoms. So if a child displays 6 or more of these symptoms here, they can, and it has to last for 6 months at a time, from 16 years old and below, they could have a diagnosis of ADHD. But these behaviors, if you look at this, you can think, well, every parent can say their child does this, right? This is, my child can be careless, they have difficulty paying attention, following through, but this has to cause some kind of a problem in their day-to-day activity. So it's going to cause like behavior problems at school, even at home, playing a sport, socially, academically. When this is an everyday problem, that is when it can be considered a symptom and looking to a diagnosis of ADHD. So for 16 years and under, they would have to present with 6 of these symptoms. For 17-year-old and older, it's 5 of those symptoms. So the inattentive type, I want to go into that just a little bit. So the child with an inattentive pattern in the symptoms are less likely to act out or have problems getting along with other children, and they might be able to sit quietly, but they may have a problem paying attention, like really focusing and paying attention. Children with an inattentive presentation may have trouble learning things that are new, but they can exert significance and focus on things they are really interested in or have done repetitively over and over, which is called hyper-focusing. Sometimes you might look at a child that is hyper-focused on something and say they're obsessed with a certain aspect, you know, or a certain thing. They just focus on one thing. They're hyper-focused on that. And
maybe
all
video games.
Yes, like I would rather play my Xbox than focus on this book because, you know, they're getting some stimulation in their brain from that. So it's easier for them to pay attention to that. Oftentimes in a classroom setting, you can see that they make mistakes, you know, careless mistakes. That would be something that, you know, you wouldn't expect them to make that kind of a mistake, but they're kind of overlooking the details and focused in on one thing. So I thought about, and this is how I kind of like to explain this. So a person or a child that does not have ADHD, and we're looking at a painting, we can look at that painting and see all the different things in that painting, like all the brush strokes, the different colors, the different objects in the painting, and we can kind of put all that into our brain at the same time, but still see the big picture. With ADHD, they may focus on one object in that painting, you know, and they see that one object. They're not really seeing the detail. They may even be able to tell you what the picture is, but it's those details that may get a little cloudy. Another example of this in a classroom would be the math, like the new Common Core math, right? That everybody wants to pull their hair out about. So you have a child, and we'll get into this, that, you know, all the time with ADHD, majority of the time, these kids are very smart. They're average or above average in learning. So they could look at a problem and come up with the solution fairly fast. But to explain to you how they got to that answer could be extremely difficult for them, because it's those details that is hard to process in the brain. So that's how you could see it in a classroom setting. And we went into, you know, talking about, it doesn't look like, or they're ignoring you. They can really focus in on something else, and a parent could be saying, I need you to come and eat, or, you know, I need you to turn the Xbox off. And it looks like they're ignoring you. You know, they're not responding. They're not even giving you an answer, like, I'll be there in a minute. Can I have 5 more minutes? But honestly, they could be so focused on what they're doing that they're hyper aroused by that one thing that is going on in front of them. Or they could be in their own thoughts. They could just be truly thinking about, daydreaming about a circumstance or situation. And, you know, oftentimes this can appear rude again. So you've got to look at the behavior and understand the brain to understand that they're not just ignoring you or trying to be rude. So we can go to the next slide, and we'll talk about the impulsivity and the hyperactivity on the other side of it. And children with the hyperactive and impulsive pattern of symptoms are more commonly associated with ADHD. These children can have really a hard time sitting in a chair, sitting there for a long time in a classroom. They can struggle to get along with other kids, right? Because they're wanting to stand up when they're supposed to be sitting down. Or they're wanting to, well, I don't think that we have pencil sharpeners in the schools anymore. But back in my day, which I'm kind of speaking my age, we had the old-fashioned pencil sharpener. And if any of you all listening that is my age will remember, it seemed like in every class there was a child that had to sharpen their pencil at the worst time ever. Like, the teacher is trying to teach and this child is up and at the pencil sharpener. And I had some teachers that would get very frustrated with that. And now that I'm older and I know a little bit about ADHD, I'm like, poor little Sally or poor Johnny had ADHD. They truly needed to sharpen that pencil at that moment. That's just what their brain told them. So that's what that can look like. You know, a kid that is impulsive, wants to be out of their chair, has to go to the bathrooms, got to ask the teacher a question. And that can irritate other kids around them, which could cause some social problems as well. And sometimes that causes them to have a hard time or inability to play or engage in certain leisure activities quietly. We kind of touched on this a few minutes ago, but it would be like a parent saying, you know, we're going to settle down now for the night. Let's read a calming book. Let's turn the TV off. And that can be very hard for a child with ADHD. It can be very hard for them to shut their brain off and participate in a very calming, quiet moment for a long period of time. And later on tonight, we'll talk about some ways that you can do some quieting exercises and some coping skills that are not going to be such a very long time, but that you can help them calm that brain down rather than playing the Xbox until 9:30 at night. So there are some things that we can do with that. And now I'm going to turn it over to Keisha, and she's going to share a little bit more information with you.
All right, and Dr. Love, if I can, thank you. So I'm gonna talk about the comorbidities. Comorbidities are like diagnoses that are run similar or run with ADHD. It's not here for the purpose of this presentation, but you can also include autism in there. And you can kind of think of neurodevelopmental disorders as a spectrum similar to the way that you would think of autism as more of a spectrum disorder. So ADHD often presents with other diagnoses, including externalizing disorders like conduct disorders, oppositional defiant, mood disorders, internalizing disorders that are less not always known because we are more observant and bear witness to the externalizing behaviors, the acting out. But anxiety and depression also run pretty heavy with kids and people who have ADHD. Overall, probably 65% of children will, with ADHD will have one or more comorbid conditions. So that spectrum is, you know, where do they fall within in that? If you're working with a psychiatrist, a school, or a counselor, it's really important to kind of advocate for more assessment with regard to these other diagnoses, specifically learning disorders. I would be my take on it, and I'll kind of talk a little bit why, but I'm gonna kind of give you some numbers here first. About between 10 and 20% of kids with ADHD have mood disorders, and those are specifically related to regulating their emotions, difficulty, maybe even understanding their emotions and processing them, understanding how they feel in their body, and then also that communicative interpersonal relationships with other people as well. 20% have conduct disorders, that's the acting out, which can be really tricky when you have, like Gretchen just described, inattentive and hyperactivity and impulsivity as behaviors that may come off to other people as rude. So if you're kind of considering that for conduct disorders, you know, kind of teasing that out, what does that look like? And other factors that kind of are linked to these are an increased propensity for people to have these difficulties are increasing levels of familial etiological factors, socioeconomic issues that directly link and kind of make it more difficult within that framework. If you're treating the ADHD and maybe you've noticed some improvements, but not enough, I'm going to talk a little bit about learning disorders, like really look at learning disorders, things like dyslexia, dyscalculia, dysgraphia, phonological processing, language disorders. Those things are not necessarily well known or talked about, and then they're kind of clumped into like this thing of like learning disorders or special education, like those things. But most of these kids do have average or above average intelligence, and like the issue is with the instruction that they receive and how they're being taught, opposed to if they're smart or not, or their level of intelligence, which in terms of depression and anxiety can really cause some self-esteem issues and mental health concerns, coupled on top of ADHD and some other comorbidities. If your teacher is teaching in class and she calls on a student to read aloud, a kid with ADHD or learning disorders might be reading ahead because they're anxious, like maybe they read slower, or maybe they don't know, can't recognize a lot of words. They will try to read ahead of time and kind of be hyper vigilant about that, to kind of practice reading in their mind. And that's very anxiety provoking for those kids. Other kids, that's more of an internalizing behavior. So when you're thinking about inattention or things like that, those are more like geared towards the internalizing something, which gets passed. Like the inattentive type might not be noticed as well as the impulsive or hyperactivity type. It's be careful with genders, because girls tend to internalize more than boys. And so if a girl has a learning disability coupled with ADHD, she might look very different because she's sitting in silence and kind of feeling really bad about herself, whereas a boy may make a funny joke or tease someone, so he gets kicked out of the class, so he avoids and escapes the need to read. And so reading itself is a problem, or difficulties in school as far as participating in the class is one thing, but if your teacher called on you to read, she also, and you struggle with that, or you can't pay attention well enough to do that, she also just pointed out your weakness to all of your classmates. So then you have to think about bullying and kids making fun of other kids in the classroom, and how that negatively impacts mental health and self-esteem in that regard. So that is to say, if you're treating something, and dig a little deeper sometimes, because it's not always just the ADHD or conduct or how we are observing. We really need to explore some of those things. And can I have the next slide, please? Sorry, I feel like I just talked a bunch. So the causes of ADHD and really all the neurodevelopmental disorders are directly linked to genetics, toxins in the environment, and diet. There is some debate on some of these things. The research is, depending on who's saying it, I guess, is a little skewed. I might be a little biased myself, but there is some challenges there with like what is directly causes neurodevelopmental disorders. So it's primarily genetically passed down through genes. It's estimated that about 70% of genetics do attribute to ADHD, but there are no like biological markers that exist. So you can't test your gene to see if you have the gene that turns it on, or are you going to pass it down to your kids, or how to proactively prevent it in terms of genetics. Some other kids with early onset may experience those social economic factors, poverty, maternal anxiety, postnatal years, harsh parenting, family discord, things that are going on in the home. And then we'll take it also to the next slide. And we're gonna kind of go into kind of like a 2-in-1 is what this is. And so it's environmental, but also we're gonna kind of get into some diet stuff here. One of the things that is not necessarily always talked about is the psychosocial risk related to diet, unhealthy diet, too much sugar, too much fat, that is associated with behavior conduct problems. A potential mechanism that might explain that link is unhealthy diet. And we can kind of think of it in the term of epigenetics. Are you guys familiar with epigenetics at all? That is kind of your genes, right? I like epigenetics a lot. It's your genes, but how the environment impacts your genes. And you can think of the environment as what you put into your body, but also physical objects or tangible things within the environment, also attachment things with family as the environment. So it's like a comprehensive, sometimes we say things like nature versus nurture. Epigenetics is like, no, it's nature and nurture sort of deal, okay? So this picture says, I want to eat fruit, but my baby wants cake. so basically epigenetics kind of says that the developmental pathway for early onset is determined by the environment, mother's diet, things like that. And we can go on to the next slide. So this slide kind of, it says kids ages 2 to 18 should have less than 25 grams or 6 teaspoons of added sugars daily for a healthy heart. And my take on this was just like, if it's good for your heart, it has to be good for your brain. And anything more than that can't be good for your heart, can't be good for your brain. So simple sugar consumption causes hyperactivity, given that like these snacks contain high sugar content that produce the secretion of insulin in the pancreas, resulting in hypoglycemia. Some studies kind of suggest that you can experience hypoglycemic or elevated levels without actually being diagnosed with hypoglycemia. So you can just have disproportionate levels of insulin and sugar that stimulates epinephrine, leading to the activation of a nervous reaction in your body that causes hyperactivity. So it's basically sugar is ramping you up. The debate about that within the research is related to sugar specifically. Some researchers say that sugar is shown not to have any effect on kids. Meanwhile, parents and teachers like, one juice box too many and we're done for the day. We're having to fight, we might need to go to bed because now they're restless. So, we have pretty good expert groups that are talking about these things. We always like to say, like in counseling, that like the client is always the expert on themselves. So we like to trust parents and teachers in what they're observing. If you had that special holiday party or something like that, you might notice things that are going on. So yeah, nonetheless, there's some association. And we'll go to the next slide. So sugar, the need of sugar in like when Gretchen and I were like doing the research, we thought about diet like really heavily, and it kind of sparked a question of like, what's in baby formula? And so we went there, and boy, like it was really insightful. Currently, the FDA does not regulate types of sugar, the specific types of sugar that goes into baby formulas. And even organic ones, things that are good, we kind of like don't really know how that interplays with brain development. Some doctors are concerned that sugar in baby formula specifically can cause like early tooth decay, and that's like rotting before they even get their first set of teeth, because they're drinking formula. You might find in like the neurodevelopmental disorders altogether, kids preferring sweeter foods, or kids having texture issues and things like that. A lot of the research is linked in that regard to sugar and kind of early diet, some of which is processed in the prenatal stage of development, while the baby is still forming. Other things linked to like obesity later in life, because the preference for sweeter foods as well. And we'll go to the next slide. So a healthy amount of research notes that children that are breastfed have less brain abnormalities, are less prone to brain abnormalities, which is the neurodevelopmental. So neurodevelopmental is pretty much brain development. So there were some studies done that they surveyed mothers like as soon as they had their babies, to kind of see who's breastfeeding, who's not, who's maybe supplementing breastfeeding with formula fed in between when mom's not available, and things like that. And it was shown, they did like a regressive study after that with those same participants, where they went and surveyed them during second grade, so about 9 years old or so, to see the duration that moms breastfed. And it was shown that the formula fed babies had like almost like twice as high of an increased rate of brain abnormalities, and that there's a significant correlation between breastfeeding and a healthy brain development. And then in addition, we kind of just went into the whole thing about breastfeeding, right? And so I hope that I say this with respect and articulation, and it is pretty heavy stuff, so I just want to be considerate of everybody. So with breastfeeding, the baby's saliva has communicators in it that communicates with the breast of nutrients that it needs to pull from in the breast milk to the baby. And so that made us think about, like, even if you're breastfeeding but you're using a bottle, how does that impact the nutrients that the baby needs for development? Additionally, the mother's body produces milk when the baby needs to be fed. So that's why women wear like breast pads and things like that. So how does dairy affect brain development? And maybe, like, we're all human, the bulk of us in the United States anyway have had dairy. A lot of people have consumed dairy, but that critical period of early development, how does that play on or interfere with a healthy brain development? We don't know. We didn't delve that far into our research, other than that there are significant correlates there. So yeah.
And I suspect that there's some correlation in terms of the touch of the mother, the closeness, the calming, because that and the ability to calm motor skills of a baby, helping a baby self-soothe, all that touch, that's a big component that is likely a piece of breastfeeding, because we'll touch on towards the end of the presentation about sensory issues, motor skills, things like that. But being able to calm the child is a big piece. And the inability to calm and self-soothe plays a role in the possibility of it looking like ADHD, anxiety, another disorder. So there's a lot of things that are just possibilities. And so it's just a wide variety of information we're providing today. So next slide, I think.
Yep, it's the next slide, and then Gretchen's gonna take it from there.
Oh, Gretchen, you're on mute.
Okay, thank you. I'm going to go relatively fast through this little slide here, but does the brain need sugar to function? And I would just love if it was like, yes, it needs all kinds of sugar, because everybody loves sugar, or most people love sugar. But the brain does need some sugar to function. The human brain actually functions exclusively on glucose. So the glycemic index deals with how glucose is processed in the body. So when we look at sugary foods that are heavily processed, that can cause the body to produce and process sugar way too fast. So the issue is that processed foods can cause in the body has to do with the rate at which sugar is processed, right? So when you look at a child with ADHD and you're fighting with them in the morning to eat their breakfast, you know, you got to have it. I know my parents used to say breakfast is the most important meal because you're going to be at school learning. You know, it helps your brain function. So you got to have a breakfast. But some of those breakfast foods can actually be really bad for children with ADHD, children across the board, adults across the board. If they're heavy in sugar, artificial colors, preservatives, all of that can cause the brain and the glucose to produce and to process super fast. So you take a Pop-Tart. Your choice is a Pop-Tart in the morning. We're in a rush, we gotta hurry, you can have a Pop-Tart. It's better than not having anything, but actually having nothing could be a better choice in some instances. Because if you think about adults, midday, we're feeling a brain fog, we want a sugar rush. Let's go get that coffee from Starbucks and, you know, put a lot of cream in it, or the donut in the afternoon, and it will spike. You know, we've called it a sugar spike. You know, it will spike your brain and you wake up. The problem is it will plummet super, super fast. So you can really crash. So if you look at that with a Pop-Tart, that can happen with a kid, and especially with ADHD. So you're going spiking really fast, and then you're plummeting with the child, and their brain is wanting stimulation. So that can cause them to act out, to have, you know, be more hyper even when they've plummeted, because their brain is seeking that arousal. So a healthier option, example, would be oatmeal, because it's a natural sugar, a piece of fruit. And what happens with that, the body and the brain and the glucose, it causes it to process very slowly. Instead of going really fast from high to low, you've got a very common and a very steady process taking place of those healthy carbohydrates, those healthy sugars. So a good bowl of oatmeal, or a banana or an apple, like a banana and peanut butter, or an apple and peanut butter, can actually help the child make it through lunch, because that's taking that long to process those sugars, and it can be very effective for a child with ADHD. Keisha, I'm going to give it back to you. And you're on mute.
We'll go to, there we go. So the third kind of contributor or cause of ADHD is environmental toxins, some of which being cosmetics. Your skin is the largest organ that you have as human beings, and it absorbs about 60% of what you put on it. So those chemicals that are in certain cosmetic products do impact the developing baby. Also, some of them like have, I don't know what you call it, like they produce other chemicals. So like we read like some mascaras even like produce like formaldehyde, and I thought to myself, no wonder why my eyes burn all the time. You know, but like those things are harmful, and some of those, the preservatives, the artificial dyes, those are things that we're also seeing come up in foods as well as being harmful. So it's just important to kind of use less harmful cosmetics, or maybe a choice not to wear any cosmetics at all, just being like mindful of what we put on our skin and things like that. And we'll go to the next slide. Other environmental toxins are cleaning products, things that are found every day, and a baby or a kid or a human being, like just an adult, does not have to necessarily have direct contact with that particular chemical toxin. Just being in the same room as that toxin can be harmful. Breathing the air, being in that space where fumes are. If you just, you know, wood polished your table or Windexed your table, and babies running around, you got carpet fresh or something on the floor and babies crawling around, those things are coming through the skin and through like the airways of development. Even and a lot of like cleaning products are used to like neutralize bacteria or kill viruses, and so we think that they're like very clean, but they can be harmful. Even cleaning products that are used in hospitals are understood to be dangerous, and even though the room may be sterile, it kind of just makes us think about the environment that we have babies in hospitals. You know, they're clean, but also have this other issue that we didn't really know that much about. So some of the chemicals are laundry detergent, treatments for swimming pools, food preservatives, shampoos, conditioners, things like that. So I feel like we're in an era of like being more mindful and becoming more aware of our consumerism in products as well. But this kind of like drives some of that thought process and logic home a little bit.
I'd like just to add something real fast, Keisha. So this is a lot of information, right? It could be very overwhelming because we're looking at like sugar and diet and products, and especially if you're a parent, you know, because you want to feel like you're doing the best for your child. And I also want parents to know it's not that we're trying to throw this at you, that you have to completely redo everything that you're doing. But just think, if you do one or two things,
Yeah.
what a difference that can be for your child. We want to educate you on that and assure you that, you know, you can make these changes and be a great parent as well. So I just wanted to add that in.
We'll go to the next slide. Okay, so kind of prevention and treatment, we kind of just summed up, and I'll just piggyback off of Gretchen, and like doing what you can. Like, we're all living in the same world and we're all exposed to the same things. You can't avoid everything, and you know, you might make more mental health issues for yourself and for your kid by worrying about every little thing, but the goal is just to do what you can and be mindful of products you buy are just being intentional. Like you can't, it's not reasonable to change everything. Working to just like basic improvements, improving mom's nutrition, improving sugary diets. Some of the behavioral interventions with kids and diet work really well, of like removing all sugary food, but also reinforcing that by offering the kid choices. Eventually we're going to get hungry and we're going to say, hey mom, I prefer the oatmeal over the banana for breakfast, or something like that. So kind of removing, so there's no choice for the more unhealthy options, but also making it a positive interaction by saying, hey, these are your choices, and kind of like really just sticking with the choice option after you remove those things. Other things that you can do is be mindful. Stimulant drugs are often prescribed for ADHD. There are some other like vitamins that kind of target some of that stuff, regardless of whatever treatment a parent elects to use for their kid. There's no harm gonna come from improving a diet or changing those things, and meds can be scary. My take from that would be open-minded about meds, and then also be open-minded about medication reduction plans. The goal is to maybe use meds, and then we work on some coping skills as we kind of tame some behaviors, and then we will check in with doctor in maybe a year, 6 months, and see how those things are going. If we've made some improvements in behavior, the goal is to taper that drug down and eventually eliminate it or reduce the dosage to as small a dosage as possible, if not completely have it go away. But you want to work with the kid to give him some skills in regulating his emotions, regulating his behaviors, while also helping, just with focusing and things like that. And yeah, that's that. We can go on to the next slide.
Yeah, just some additional pieces. I think one of the big components, if you're pondering if your child has attention deficit disorder, or if someone, a pediatrician, a clinician, psychologist has already had that diagnosis documented, it's important to possibly rule out any other possible causes. One of the things that I have found really helpful is to rule out any possible sensory integration issues. For a lot of parents, it's overwhelming to think of, oh my goodness, how am I going to change diet? How am I going to change, cleaning products? How do I manage school lunch if now my child doesn't eat the same thing everybody else does? And ruling out sensory integration issues can be really important, because sometimes those kids will stand out because maybe they're hypersensitive to light, hypersensitive to noise, to sound. So being in a classroom can be very stimulating for that child. Parents will describe things like their child has to have their shoes incredibly tight, or their socks have to be a certain way. They can't tolerate tags. So when we think of our five senses, if those are hyper focused, hyper aroused, and so that child is truly distressed, how can we handle those things in a really natural way? How can we dim the lights in the classroom? How can we provide that child some movement while they're seated? How can we provide that child with options for clothing at home, so it's not such a battle getting dressed in the morning? And for a lot of parents, there's a book that has been suggested to me. I suggest a lot of times just take a look. It's called The Out of Sync Child. It is listed later in the resources. But if you skim through that book and you think, oh my goodness, this sounds like my kid, it's probably worth talking to the pediatrician about and possibly getting a referral for an occupational therapist. Just take a look and help explore that, because sometimes that more of a natural therapy, like occupational therapy, to just calm their motor skills, calm down the senses that are just so revved up, they look like attention deficit disorder can be incredibly helpful and might mean less medication, might mean less struggle at school. So when we talk about looking at the whole package, ruling out learning disability, sensor integration. So, and it might sound like a lot of content, and know that you don't have to do that by yourself. That means you and your child's counselor can go through that process together, reach out to the school counselor. One of the pieces with the school, if you're not aware, if your child does indeed have a diagnosis that's been documented by a doctor or a licensed clinician, the option of a 504 plan with some potential accommodations at school is an option. I'm not going to speak too much about that, or my guess is, some school systems right now pretty overwhelmed, won't be thrilled with me, but you do have that right. So talk to the school counselor, get the information, because if your child has that diagnosis and some simple accommodations, such as you having a copy of the teacher's notes, or having the materials enlarged, or not so much on the same page, those types of accommodations can really be helpful. And that's something that you probably would want to explore more specifically with a school counselor and potentially your pediatrician. Counseling, I think, is a resource for anybody, because any of these diagnoses, there's going to be a big range. So when we talk about a spectrum, think of it as like a 1 to 10 scale. The kid may be on a 10 as a kid that's like, wow, I am so exhausted as a parent, or so exhausted as a step parent. I really need some help. And 1 might be the kid that maybe just barely meets the criteria, and that can swing back and forth depending on what's going on that day, depending on what's going on in their development, puberty, you name it. So just being aware that that range can go up and down. So you're going to want to check in with a counselor, check back in with a pediatrician to see, because the needs of the child could go up and down, just as the diagnosis might shift and might go up and down in severity. So it's not like it's a life sentence, that this is where it's set at. So just want you all to know that where you may be starting out right now can definitely ebb and flow, improve, and decrease for, incredible success in terms of adulthood and success in college, high school, you name it. So one of the pieces that is really important too is to advocate to have social skills education for children that might be struggling with ADHD, because just basic social skills can be difficult, and especially when we're all aware of how isolated we've been. So how you can have your child engage in a way with some small group settings. There are some community activities that have definitely opened back up, the YMCA, for example, some of the camps. So trying to find options for the child to still socialize and have really healthy social experiences. So that can really help the self-esteem, really help the confidence, and so then they're less likely to struggle with other diagnoses such as anxiety, depression, and so forth. And one of the pieces too that I think is just so much easier from my perspective as a parent, as a mom, and as a counselor, is just to really help people come up with ways to positively reinforce behavior. Because doing positive reinforcement, rewarding good stuff, is so much easier than handling the consequences when we are exhausted. So coming up with maybe just a really simple token system. And I'm certainly not saying go bribe your child, not that in any way, but maybe you just want to track 1 or 2 behaviors and reward those. So you just get some slow, steady improvement over time, because it's much more pleasant as a parent to reward behavior than to consequence behavior. Even something that can be really simple, almost like a lifesaver as a parent, if you have like a reward jar. And let's say you're having a day that you are just exhausted. Life is getting to you, kids are struggling. The reward jar could have a lot of things in it. Could be, they get to pick their favorite cereal at the grocery store trip. It could be they get to pick 20 minutes of a game with mom or dad. Could be you'll do their chores for them that day. Could be anything you can think of. And so, be very conscientious of any price range as well. And so that reward jar might save your day. It might be, do this, this, and this, and you get to pull from the reward jar. And that can be such a gift as a parent. So finding ways that handle it in a positive way can really help you as well in terms of your coping and interactions with your child as well. And one of the things, we can go ahead to the next slide, because we've got an example of a way that you can just help calm yourself down, and it also assists to calm the child down, because trying to combine that, breathing techniques, whatever that you can do with your child, can really be helpful for you and for them. So I think Takesha had an example.
Yeah, and so it's kind of like a tip, but just to practice, so focusing on breathing, when kids are ramped up, or maybe you're ramped up, a little bit of both, and there's some discord between you, taking time out first, reconnect with your kid before giving a command, like doing this or doing that. If they're aroused or hyper or completely emotional, and you are as well, making a connection, just kind of stopping where you're at, and taking some breaths before doing that and engaging. So this is a tip to just like practice with your kid, about teaching them how their brain works, so that you guys can do that practice together and run through the process of taking action and following up on the command that you give, or the directive that you give later. So they're gonna make a fist like this, right? And this is like what we would call like our hand model of our brain. So it just represents the brain. You have a left side and you have a right side to your brain. You have an upstairs and you have a downstairs. And the upstairs is where you make the good decisions and do right things that maybe mom and dad are requesting. And the right brain usually engages when you're feeling pretty upset. So we're going to think of this as the fingers as the upstairs right here. This is where we think at, okay? And you can teach your kids, like, this is where you think. Like, think of this as your brain. This is where you think. This is the upstairs. And then you can do like this, and then this is the downstairs, right? These are your big feelings. And we have an issue when there's a space between these upstairs and downstairs brains, right? So to fully function, the brain, they have to connect like this. And so this is good regulation, good thinking, integrated together. And we can do like this. That's kind of when we flip our lid. We're emotionally dysregulated. This space right here leads to whoop, right there. And so kind of before, like in the morning when you get ready, or before bed, you can kind of practice that exercise to have them think about how they're processing their emotions, or how they're thinking about what they're doing and paying attention. Maybe if you're outside or you're somewhere, you kind of do the little hand signal just to kind of give them a reminder of, hey, you need to stop and think about what you're doing. Hey, do you need a minute? You know, you can use that to kind of call your kid over, and then do some breathing exercises. I always like to recommend square breathing, inhaling for 4 seconds, exhaling out. So you just think of a square as 4 sides. And then if there's some difficulty breathing in that, like your kid is maybe, you know, trying to explain something like that, just taking that time and doing a deep breath, practicing. And as you know, say your lid is flipped, mom's lid is flipped a little bit. So we're going to take a couple minutes and take some deep breaths. Breathe in through our nose for 4 seconds. Breathe out through our mouth for 4 seconds, and kind of doing that a couple of times to regulate. It may be more important if there is some shortness of breath or fast-paced breath, to focus more on the out breath than the in breath sometimes, so that you don't produce more rapid breathing. So that's kind of.
Yeah, and I think finding options that you start to do some of that really automatically with your child, because it can in those moments be just as much for you as it is for them. And so saying, you know, let's take some breaths together, also takes away some of the power struggle. It's not so much, you know, you need to take some breaths, it's I will do it with you. Things to calm the nervous system, you know, things that sometimes we get away from as our kids get older, putting our arm around them, hugs, pressure. You could even both of you could lay down on the floor and look up at the ceiling, take some of the power struggle away, the eye contact, and you're both getting the pressure on your nervous system of being on the floor and taking some breaths and just really opening up your diaphragm. So just coming up with some really natural ways to calm your nervous system for both of you can really be helpful. There's yoga exercises. There's a lot on YouTube that you can find that's just calming and fun activities for kids, and just really encourage everybody to actively do it with your child, and they're going to be more willing to do it. And you'll also find some tips and tricks that you can just incorporate in your day, because it's amazing how much when our kids amp up, how much we've amped up with them. And so just trying to calm down ourselves can really be an important role in that as well. So.
And I also just like the education with it, because if we're thinking about impulsivity or hyperactivity or inattention, that education can help with recall so they understand what they're doing, and then getting in the practice of doing it so that the brain like recalls like, hey, I know how to calm myself down, I know how to do this. So it's kind of like a very intentional but fun way, and like also that attachment and bonding moment for both. And like sometimes people say like breathing doesn't work, or I can't do it, but if you don't practice, then it's kind of hard to get it regulated when you need it. It's like if your job has like a fire drill every month or quarterly or something like that, and you practice knowing where the fire extinguisher is, and the fire goes off and no one knows where it's at, that's kind of what happens in your brain. You're trying to put something out, but like your brain doesn't know, what do you do in this situation? Well, I just respond how I would normally respond. So it takes some very intentional practice with breathing to help the brain recall, like I need to take a breath because I'm short of breath. So that will help be more mindful as well.
Yeah, I think the next slide, yep, there you go. And so, Dr. Love, did you have questions or wanted to open anyone to questions?
I have just a couple about, I guess we were going to close out with this slide, or no?
No, go ahead, and then Takesha, go ahead, and then I'm going to open the floor to questions, and then I'll close out. Yes.
So these are kind of like some more like leisurely reads, and one is like a YouTube video. Dr. Alan Shore does a lot of research and work on neurodevelopmental disorders and epigenetics, environmental. So that's just a YouTube video. It's long, but it's very informational. And then Gretchen can talk about the next one.
Thank you, Keisha. This is a podcast that I come across. Dr. Newmark, he specializes in ADHD. It was just very intriguing, very informative, and very encouraging to hear his take on it, evidence-based. And he gets a lot into the diet, but not just the diet. Keisha kind of touched on it. Making those choices and empowering your child to make those healthy choices, and to get through ADHD as a parent and as a child in a very healthy, functional way. So I encourage you, if you have time, to listen to that. I mean, just listening to his podcast, even though I don't have ADHD, it really encouraged me to rethink the things I put in my body, and just different modifications that anyone can make on a personal level to enhance not only their mental capability, but also their physical body as well. So it's a super, super amazing podcast.
Very good. I want to open up the floor to questions now.
I don't have any questions, but that was a very thorough presentation, and I had a lot of aha moments. I am a parent who did nurse my child for 18 months, in fact. And so a lot of what you said, and he's in second grade, and his cognitive ability impresses me. And I'm just like, that's my child, you know. But I did feel like during the time that he was born that it was important for me to nurse him. And then because I nursed him, he would not take a bottle from me ever, ever. So very rarely did he have formula. So the research that you guys have done, I feel like that's very comprehensive, and it validates what I chose as a parent to do for my child. I didn't intend to go 18 months. It just happened to go that long, but I'm very, very glad that it did. And I feel like for the most part, I am reaping the benefits, especially when it comes to his education, because he reads. Like, he's such an avid reader to be 7 years old and the level that he reads at. And I know that diet has a lot to do with it. And then when you guys talked about sugar, I was like, oh, let me exit the call real fast.
You know, I wanted to say it was interesting how you said that. Kim, is it? Yeah, we could have went down a real big rabbit hole. Me and Keisha were like, okay, we got to quit. We got to quit because we could get so much information from this, and not just the mental or, you know, our physical health and behaviors, but our mental health. And the breastfeeding, like Keisha kind of touched on this, you know, the mother's body knows when that child needs to eat, because she produces milk at that moment.
That was just so fascinating to hear that. And when you all put the meme of, I want fruit, but my child wants cake, you know, that's something as society, we let a pregnant woman eat whatever she wants to eat. But when a woman restricts her diet to healthy things, then we want to say she has a problem. Pregnant women should eat more healthy. We really should be selective about what we put in our body. And so when I nurse, I recognize that what I eat, he eats. So I was very conscious also about my diet. But then since COVID, we'll blame it on COVID. Ice cream has become my best friend. And like you said, it's a coping mechanism. I can't remember, Takeisha, that the terminology that you use. But the nature versus nurture, right? Because when we get stressed out, the other day I had like a lot of work to do, and I'm like, I may or may not have had mint chocolate chip ice cream for breakfast, but hey, it helped me get through the day.
Yeah.
Well, I can affirm Kim's son's brilliance, because he's 7 years old. He's building a business model. I mentor him during the week. He gives his presentations on Sunday, and he has a peer group that affirms him. Every presentation has been on point.
Wow.
And even when they're providing feedback that might seem a little harsh to his mom, he takes it. He takes it because he's constantly learning and growing and developing. And I'm just so amazed. 7 years old, Drew the gamer. So he's going to teach everybody how to play video games efficiently and effectively. He's an amazing child.
Thank you so much. Thank you for saying that. And another thing about diet and nursing my child, I notice he does not get sick very easily.
Yeah.
So like last year, half of his class was out with the flu or whatever. He just does not get sick very easily. I know they call breast milk liquid gold. It really is. It really is. If you're capable of doing it, I think that it is very advantageous for anyone who's capable of doing it. I know that some people have issues that may prohibit them from doing it, but if you are capable, I believe that it does really truly benefit the child, and it helps to create that bond between the child and the mother.
Yeah,
absolutely.
Yes, for sure.
Hi, Sienna.
Hi, I was gonna say I'm on the other end of the spectrum. So I have two kids. One, my oldest child, Sumaya, let's just say we fought and struggled because she wouldn't breastfeed and I wanted to, and she didn't. And so it was kind of like a toggle between the bottle and the breast milk. She's 12 now, and the first couple of years she was very sickly. She was like, you know, like from the time she was born, she was allergic to the dog. I mean, it was just a lot. And I'm not one to, I'm a very good eater. There's a lot of things that I don't eat. I don't even like pizza. Ice cream, I can only eat a minimal amount of sugar. Like when I took the glucose level, they said my sugar level was bland. This is me, you know? But as she grew older, I find that she does not get sick at all. So I don't know if it is due to the fact that she was exposed to a lot of germs as she was a small child, or what have you. But I do take it into account that, you know, she was on breast milk sometimes for 6 months, and then she doesn't get sick. However, on the other hand, my youngest child, she's 14 months, therefore 2 months apart. She breastfed throughout the whole, I only did it for 6 months. I commend you for 18. That's just, I was working. I can't even do it.
Thank you. It was not on purpose. I did not plan that long, but it just happened that way.
If I had to, I probably would have done it, but 6 months and working wasn't an option. Like I was just like, we gotta call it quits. But Persephone, she does not get sick. The one time she got sick, it was like, why is she sick? Like, what do we need to do? You know, and she's also my gifted child. Now, reading some of the descriptions of the HDAD, it has me wondering, like, should I go get her tested? Because I've always thought that she was, what's the word you use? Careless with some things, but at the same time, it's like she's very in tune. Like, you know, I think she was like, I don't know, a month old, as she was whistling, like physically whistling from her mouth. Like it was just crazy. And she learned how to talk at 9 months old. Like I could understand what my baby was saying at 9 months old. It was like, and people were like, what did she say? Like I can understand her. So to have the two like spectrums, it's totally blows my mind. But I say all that to say is, like, I think you mentioned something. So what are some steps that parents should take as far as like getting diagnoses and natural steps? I know you mentioned vitamins or someone.
Yes.
Vitamins.
There is vitamins that like are specifically for ADHD, and I think that they have, I'm sorry, I probably should have wrote down like the brand names, but they have, what is it, DPA and EHA?
Oh, DHA and yeah.
Well, likely the best place to start is typically with your child's pediatrician, because you'll want to rule out if there's any other factors playing a role that look like attention deficit disorder. And then that's always a good place to ask in terms of, you know, vitamin recommendations. What's your pediatrician's preference? There might be an option for a prescribed vitamin versus over the counter. So there's so many options. That's the part that can feel really overwhelming. And so turn into the pediatrician first, and then they may or may not recommend to go to a counselor or psychologist for some more formal assessments. There are some pediatricians that will send parents home with, they're called the Conners rating scales for both parents to fill out. If there's, for example, a grandparent helping raise children, they might fill it out. Step parents, they also would encourage a child's teacher to fill it out, so they get a look at what the child's behavior is like in several settings, not just with one setting. So There are other assessment tools that, you know, a counselor could provide. So there's options. It's not like a one size fit all, fill out this form and boom, you've got attention deficit disorder. Because that's where it just gets a little messy trying to rule out, could it be something else? Could it be, you know, a worry, a concern, you know, poor sleep for a bit of a time period. So trying to look at the big picture. And then just kind of narrow down, is attention deficit disorder the actual diagnosis or not? Might be. And then determine what's the best treatment. And a lot of parents definitely want to start out with vitamins, food options, diet options, things like that. And most pediatricians are going to encourage those things before they steer towards the possibility of a prescribed medication anyway. See what other things can be done.
Well, so in terms of the food, so let's just say I have one who keeps eating me out of the house. Like like, if you don't go outside, you're probably going to be 300 pounds by the end of the year. And my other one, she doesn't eat. Now, the things that she does eat is salads and vegetables and things like that. She kind of takes on like my kind of eating habits. But salt is like a thing for her. Like, she's all from the time she was little, she's always like salt. And I'm like, okay, you need to calm down with the salt because, you know, high blood pressure and all these things. But for her, I think, I don't know, like it's not just the carelessness, but it's also like just being, I even had a conversation with her teacher, like she gets distracted very easily in school. Like, she's doing the hybrid. Her teacher called me. I actually had to take away her phone, because she ditched school. You know, I'm like, you have 132 IQ. I didn't expect this from you. But at the same time, you know, I have to be, she's 11. I have to be vigilant of what she's doing. So it just kind of, I don't know. I'm just kind of at a toss up at this point.
Yeah, just from a personal journey, talking to the pediatrician, number one, is Dr. Purvis suggested, and then the school has, of course, those assessments. I'm familiar with Connor, absolutely familiar with that, but the school has the IEP plan and the 504 plan as well. And so going through those developmental stages, make sure you document everything, every meeting, who you've spoken with, because some of the language I found that used to describe behaviors wasn't things that encouraged the child, but harsh language like liar, thief, this and that and the other. And you know what that does to the self-esteem of the child when developmentally, neurologically, there was something else going on. And so just staying in touch with those teachers and holding the teacher and the school accountable, because they are getting paid for, they're getting federal funds for those programs. And to be an advocate for your child is very important, particularly now during the COVID season, because things have changed and environmentally it has changed. The way they're thinking, peer development, all of that has changed. And so just going through that personally, be that advocate for your child, you know. So but just be careful of the language that some of the teachers use to describe your child's behavior.
And so it's a private school, it's a gifted school, so it's like, you know, I'm paying for this, but so the language definitely, I think they watch what they say very much so. But at the same time, it's kind of like, you know, I already knew this about my child. It's just a matter of how to mitigate it from this point.
Sure. I have a question. I'm going to tag on to that. You mentioned comorbidity. When your child is diagnosed with ADHD and there's a medication that's prescribed, does it address all of the comorbidities, all of the conditions within that comorbidity, or is it just addressing that one thing?
No. So like if you're going to use like an ADHD med, non-stimulant, or I think even like some antidepressants for ADHD treatment, it's going to treat the symptoms of inattention or hyperactivity and impulsivity. And then what's left, in my opinion, warrants further exploration. So like that might be a good gauge of like, is this medication working as a treatment? Maybe it's not the best medication, appropriate dose, and we need to try something else. Or maybe, hey, this seems effective, but we're having other things that I need to explore. Are they the issues with mood regulation and social skills, or are they related to learning challenges? And as Dr. Purvis said, some sensory integration things as well. It's, you know, you have to tease that out. And sometimes I think that assessments can be quite lengthy when you're, I don't know what word I'm looking for, taking more of a, I guess, conservative approach, or proactive, like in going to the max with like proactive, like, because you can, you know, well, is the doctor going to diagnose ADHD and say these comorbidities run, like, let's assess for these as well? Maybe not, you know, depending on, especially another thing to take into consideration is like, what is the parent or schools coming to the doctor with? Like, what is the presenting concern? That, like, in therapy, like, that's kind of like, what is the presenting? If you're only talking about behavioral things, then they may not think that school or academics or mood regulation is a problem. They may just go towards, you know, the symptoms of ADHD, because that's all the information that they're gathering. So being very attentive and mindful of some of those things. If mom's taking kid to the doctor one time and then we're still having issues in the follow-up appointment, dad takes them and their verbiage is different, that might be another piece with connecting to the doctor or connecting to the school about what we're looking at, because we might be interpreting or stating it in different ways.
Sure. That's good. Good. Good.
That's awesome.
So Sienna, you're going to talk to your pediatrician and the school.
Yeah.
As they get older, they are able to self-report better. So then they can speak to some of those things that they're observing about themselves, or that they're struggling with it as well. Sometimes that might look like mom and dad might need to step out because they may feel like, you know, parents or school may think I'm doing this, but like, no, I'm really struggling with something else and I don't know how they'll feel about it. Like, those things can kind of interplay and self-reporting. And younger kids don't have the vocabulary to say, I don't know why I forgot this, but I just forgot. I always forget. You know, like, they're not, you know, they plan. So they don't always have the vocabulary. So as a child develops, they're able to speak and provide their own self-report.
Well, let me ask you this. I mean, due to this whole pandemic thing and we're self-quarantining, is it even a possibility that this is only temporary and it's just the environment that they are, you know, now like pushed into? Like, could it be just, you know, something that is the cause and effect of what we're going through right now?
Absolutely. Like, you know, kids were like developmentally, like, some kids adjust differently at each developmental stage. So you're going from preschool to grade school, and then you go to middle school, and maybe your schedule is changing, and you have a homeroom, but you're going all over. Like, there is adjustment periods for each developmental level through school. In high school, you might be sitting through block periods of time. And for kids with ADHD or kids without, they're like, everyone's adjusting. And so when you take that into consideration to a thing like COVID, looking at what was school like last year, but also developmentally, what was the change last year or this year as well, might be appropriate. And it's just a different setting. I had some clients who, like, mom and dad were like, and this was at the beginning of COVID, who mom and dad were like, They just don't know, like we don't go to school anymore and it's not summer. And so home is home. Home's not school. Why am I having to do this? Schoolwork, like, what do you mean? We come home, we drop off our bag, we have a snack, we watch movies, and now you're having me sit at a table, and that's different, and that's an adjustment piece. No matter if there is a diagnosis or not, it's adjustment for everyone. Parents may be working at home, and that, like, how is that interplaying? Like, I'm working from home, and then also my kids over here at school. Or how do I take a break and like chime in and help with the lesson or school, and just sitting in a place that you're so acclimated to,
right,
a particular norm.
yeah. My
Some
kids
kids, like,
always been like this though.
Right.
I mean, as far as like, having difficulties sitting still, like, I had to get her into gymnastics just so she could move, and she excelled at that. I mean, she wasn't in gymnastics for a time, and she literally taught herself how to get to the next level without being in gymnastics. And it was mind-boggling. Broke my couch because she was flipping off my couch. And it was just, I mean, there was just so many things that were like, okay, we need to figure out how to, combat these issues, but at the same time, explore options of how we can, find things to stimulate her, because that's what she needs, that's why we opted to do like the hybrid situation for her school right now. But at the same time, it's middle school, it's a different setting. Yeah. For you mentioned like changing a class, they have it set up to where the cohorts stay together and the teachers change, for the subject. And so I thought that was a great option, but at the same time, they're not moving around. They're not doing these things, and she may be getting anxious and things like that to be, in school all day long.
Yeah. And I mean, like, how long have we all sat on a webinar or something that's right. Like a really long time, and like, really, I want to get out of this meeting, or I want to do this, and like, kids developmentally, they're just they're active, like, they're really active. Yeah. And so some of that is just like really normal, or maybe a kid does not meet DSM criteria for ADHD, but they have 4 out of 6 symptoms for, hyperactivity. Mm-hmm. It's to be considered, but like not necessarily meeting diagnostic criteria either. So it doesn't, technically, they don't have to, that kid doesn't have to have it, right? The diagnosis. But you still kind of can, with the language, take that into consideration. What do I do for hyperactive kids? You can kind of use that to your advantage, that word is there, and like, what are people doing with kids?
Right.
Well, I want to say thank you to all of you. This has been an incredible presentation. It's something very close to my heart, and you did not disappoint me, or the Facebook Live audience, or the Zoom audience. Dr. Purvis, you're doing an excellent job with your students. Let me congratulate you. Next week, we're going to have LaDawn Jenkins. She's the wife of Dr. Darrell Jenkins on the Board of Trustees for Judson University. She's going to talk about health and fitness, and that's something that we can all listen to, relax, come bring your tea, and learn a lot. She's from Rush Memorial Hospital, and I think it's going to be a great presentation. So again, God bless you. Thank you so much for this presentation, and I look forward to seeing you on YouTube and reviewing you again on a podcast. You ladies are famous. You're excellent. All right.
Thank you for having us.
Oh, you're welcome. You're welcome. Good night, everyone.
Good night.
Bye-bye.